Hello, we are back in session with cholinergic drugs. So as you can see here, there's a lot on the board and it's going to be a very long video, so I'm sorry for that. But it's going to be very informative. And just remember that although it may seem overwhelming, you can review it over and over again because that's the beauty of a video. And don't feel shameful for reviewing it over and over again. I do it all the time. That's the only reason I know this stuff is because it's just repetition, repetition, repetition. And then you really start to understand it. So without further ado, let's get started. So cholinergic drugs are used for urinary retention, which is when you can't pee, basically. And then they're used for paralytic ileus, which is, so ileus is a part of your intestine. And so paralytic is like pause, so so it's a pause part of your intestine. So basically, you're not able to poop. And then, so it's used to treat that. It's used to treat myasthenia gravis, which is, I know it's a really hard name to pronounce. It took me forever to learn how to pronounce it. But yeah, it's used to treat that, and then it's also used to treat Alzheimer's disease. So let's talk about what acetylcholine does. So a lot of people might have heard of acetylcholine as in like muscle contraction type. So basically, yes, it is absolutely used for muscle contraction type, so motor activity in general though. But it's also used for cognitive function, normal secretory function, again, motor activity and urinary output, which involves the contraction and relaxation of the muscles. So let's start with indirect acting cholinergic drugs. The prototype for this is neogestamine. And neogestamine is a drug that inhibits the destruction of acetylcholine by binding to the enzyme that breaks it down. So acetylcholinesterase is an enzyme that breaks acetylcholine down. And if we don't have acetylcholine, then we don't have all these functions that we were talking about earlier. And that's important to have. So this medication basically lets acetylcholine stay, and which impulses transmit between the myoneural junction. So like it says, contract your muscle, So the adverse effect is bradycardia, hypotension, and dysrhythmias. So for bradycardia and hypotension, these make sense because they are things that the parasympathetic nervous system does, and we are working on the parasympathetic nervous system with cholinergic drugs. So basically, bradycardia is a lower heart rate, and hypotension is low blood pressure. So all of them together make up different like so they make up effects of the parasympathetic nervous system, which is why you can understand them as side effects for the neogestamine. So also you should note that so you can use it for treating myasthenia gravis, but you can also use it for helping the patient get out of anesthesia, which you would use reverse non-depolarizing neuromuscular blocking agents. And if you're using those, then you need atropine available because the risk of bradycardia is like very high. So a lot of times you either use atropine before you administer the medicine or while you're administering the medicine. And so let's just talk about atropine while we're there. So atropine is an anticholinergic, so it basically reverses the cholinergic effects in the heart, in the smooth muscle, in the glands. But one really important thing to remember is that it doesn't decrease the cholinergic effect in skeletal muscle. It's used sometimes for mushroom poisoning as well. And I don't mean the drug, I mean the actual vegetable mushroom. A lot of people ask that. I asked that too. So don't feel bad if you thought that. Next we're going to talk about some other medicines that are actually in the category of indirect acting cholinergic drugs. So endrophonium is used to diagnose myasthenia gravis between MG and cholinergic crisis. And cholinergic crisis is basically the respiratory paralysis and extreme weakness of the muscles. So when you give endrophonium to a patient, the doctor needs to be at the bedside, because if it is cholinergic crisis instead of MG, then they're going to need to intubate because it's going to make the patient worse. But if it is MG, then they use to they'll start getting better. And remember that this is a very, very short-acting drug, so it isn't used to treat myasthenia gravis. It is used to diagnose. So by 3 or 4 minutes, it is out of your system, which is kind of crazy. And then one more from the indirect acting is physostigmine. Sorry, I'm really not good at pronouncing all these medicine names. Please forgive me. But anyway, that is the best choice in reversal of anticholinergic effects. So that is that medicine. Basically, that is what I'm going to talk about for those medicines. Next is the reversible indirect cholinergic agents, which is donzapol is the prototype. So the prototype, let's see if we can move this over here. Yeah, there we go. So it inhibits centrally active acetylcholine, which increases acetylcholine in the cortex, and it decreases neuronal deterioration. So it actually can prevent, whatever you want to call it, Alzheimer's for up to 55 weeks, which is really, really important. And it's amazing that we have these things nowadays. And so basically it's highly protein bound. And if there isn't enough protein in the patient, then it can become very toxic. So we want to encourage our patients to eat a lot of protein when they're on this medicine, so that we have no worries that it could become toxic. And then there's a lot of adverse effects nausea, vomiting, diarrhea, constipation, whatever. But the more serious effects are breathing problems and breathing problems and fainting and heart disease. So you want to watch out for those for your patients. And then lastly, we're going to talk about the direct acting cholinergic agents. Bethanacolol is one of them, and the mechanism of action of that one is to increase the contraction of the detrusor muscle, which is to let yourself urinate. And it stimulates gastric motility. It stimulates, it increases peristalsis, and it increases gastric tone. So we also use this for when a patient has paralytic ileus, to let them poop. So one thing that is really important to know is that you can't use it post-op for bladder or stomach surgery, but it's a very helpful drug in getting rid of the urine or the feces. And basically, last thing I want to say is the adverse effects of bethsanolol are fecal incontinence, urinary incontinence, which makes sense because it's the contracting of the muscles, you know. So you won't it might be contracting too much, and you would have an adverse effect for that. And so I put up how to say myasthenia gravis because it took me forever to understand how to pronounce that. And I hope this video was at least a little bit helpful. Again, I'm Galia, and thanks for watching my videos. Bye!